Why does Medicare have to be so confusing? Well, it's run by the government, so there's that. My name is Ed Weir. I ran the third business Social Security office in the country, and now I'm here to help you get everything you paid for from all things Social Security, disability, retirement benefits, survivor benefits. And today we're going to focus on Medicare because that is a confusing system as well. There's a bunch of stuff about Medicare in the news. So I've got a couple of experts here from Chapter. I've got Alyssa and Felix is going to help us go through navigate the bureaucracy and make sure you get everything you earn, save as much money as you possibly can, make sure you're in the right Medicare plan because it's all about your money and your health. So we're here to help y'all. How y'all doing today?
Doing good. Thanks for having us.
Yep.
Yeah, happy to be here.
Alyssa was here last time a few months ago. Felix is first time with us today, and Alyssa's in charge. What particular department at Chapter are you in charge of?
Great question. I run Chapter's member success team. So we help people actually utilize their Medicare plans and make the most out of their benefits after the advisory team, which Felix helps support, matches them with the right plan.
Yeah, that's a people can use if I always say if you have a high school friend or a nephew or son or whatever the case may be doing Medicare insurance, then obviously that's the person you're going to use. But a lot of those individual brokers out there, yeah, are spend a lot of time trying to get new clients in, and they have a difficult time doing kind of the after service. That's one of the reasons I
Yep.
partnered up with Chapter is to help with the after service. Yeah, because once you enroll in a particular plan, that doesn't end the whole thing.
It doesn't. No, yeah, then you got to use it.
Yep. All right, Felix, what do you help people with?
I am a sales manager, so I help a team of advisors, best in the business. We've really combed America for the best Medicare advisors to come work for us here at Chapter. So I have a team of 13 folks that's part of an entire advisory of sales folks. We have about 57 that are on the phones that help people. But yeah, I just kind of help them with their day to day. I answer questions. I also get on the phones when we are busy and help our clients and help people that have questions. But just proud to be here to represent our team.
Perfect, perfect. Yeah, and yeah, a lot of people need help because yeah, it's people spend their entire life doing their job, and then they turn 65, and it's like, okay, well, now I got to learn essentially a new job of how to navigate the bureaucracy. So number one is we are in the midst of a Medicare open enrollment period, a OEP. Felix, what is the Medicare open enrollment period we're currently in?
Yeah, so it started back on January 1st, then it runs through March 31st, so the first quarter of the year. Anyone that has a Medicare Advantage plan in place can make a change to their plan. I look at it as a disenrollment window. So if they made a change back in the annual enrollment period and they don't feel comfortable with their change or things have changed pretty suddenly, and that can happen, they can make a shift and come to us and we can find a plan that works best for them now. Also, you can disenroll from an Advantage plan and go to a prescription drug plan, which gets you back to what we call original Medicare. And that allows you to potentially get onto a Medicare supplement if you can pass underwriting that's required in your state, or if you're in a state that does not require that at all. So there's lots of different options. But I look at it truly as a disenrollment window where you can disenroll from your Advantage plan to go to a different one, or you can disenroll from your Advantage plan and go back to original Medicare and a prescription drug plan.
Yeah, that's one of the interesting things that people say, well, my purpose is not to get out of the Medicare Advantage to go to a Part D plan. My purpose is go to a Medicare supplement plan, but that's part of the bureaucracy. In order to get out of the Advantage plan, you have to enroll in a Part D plan, and that frees you from the Medicare Advantage plan, right?
Correct.
Yeah, it's all too confusing. All right, and let's see here. Leonard, already got hello, Dr. Ed. Just talked to Keith W. from Chapter, and he set me up with a Plan N. Thanks for all you do with the help. All right, do you know Keith there?
Yeah, Keith Wesley is again one of those top Medicare advisors in the country that started with us back right before AEP, and we're excited to watch him grow this year. He's done a lot of great things for us. Glad you got to
Awesome,
talk to
awesome.
him.
Good deal. Yeah. Yeah. Full disclosure, I always recommend everybody that watches to always, 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 if you're looking to sign up for Medicare, always check out a Medicare supplement plan first, a Plan N, a plan. I prefer Plan N because I'm cheap like that, but either one of those is fine. A Plan N or a Plan G, and at least evaluate it first. A lot of people some people choose not to because of the monthly premium, and then check out Medicare Advantage, but always start with a Medicare supplement and see if that's right for you. If it's not, then Medicare Advantage. And either one of those is better than having nothing and just having original Medicare at all. Because if you have original Medicare at all, unless you've got a few $1,000,000 under your mattress somewhere, then yeah, you're going to be in deep trouble there. All right, so they can switch from a Medicare Advantage to another Medicare Advantage and back to original Medicare, but they have to go through underwriting. What's the whole underwriting process? What's that like?
It can sound kind of scary, right? But we have experts that take place. We're going to ask you specific questions if you've had cancer in the past, if you have any heart issues, if you're diabetic and use insulin, or if you have any upcoming physical therapy or procedures. Really, anything pending or things that you've dealt with in the past several years. We're going to ask you about it. We're going to ask you what kind of prescriptions you take. Those can be declinable depending on what they are used for and how often they're used. But yeah, we'll get to the bottom of it. We're not going to sign you up or help you enroll into a plan that's a waste of your time or that won't approve you. We ask those questions to get you in a plan that's going to save you money or protect you in a way. Like you said, if you don't have $1,000,000 lying around, you're exposed significantly to a 20% gap. But we do our best to sort of uncover every stone or look under every stone, I should say, and find the right plan for you.
Yeah, some companies for a Medicare supplement, they're a little bit more stringent than others. So if someone says something, oh, I had cancer 3 years ago versus 5 years ago, there's some companies that say, okay, if it's over 3 or over 5, they're good, but others not so much, right?
Absolutely, yeah. There's look back windows, and they vary carrier to carrier. Our team is so strong that if they hear that from somebody, they're going to know to rule out those plans that are going to have shorter look backs and just go ahead and look at the ones that are going to work best for our clients.
Yeah, and anytime you do it yourself, you can definitely do it yourself, but to navigate the whole thing. And how much do y'all charge for that help?
Our service is completely free.
Exactly, exactly. So that's what it's all about. All right. So Alyssa, getting set up on a new plan. So Felix and his team have found a new plan, a Medicare Advantage or a Medicare Supplement or whatever the case may be. What do they do then?
It's a great question, Ed. Like you said before, enrolling in a plan is sort of just the start, right? After that, you actually have to use that plan. You have to go to the doctor with it. You have to get your dental benefits set up. There's so much that still needs to happen after you're enrolled, and that's where the member success team really comes in. A lot of things that are important to think about this time of year, if you've changed plans going into 2025, is to make sure that you update your information with your doctor's offices, your primary care physicians, all of that really good stuff. One of the things that Felix and our advisory team do incredibly well is make sure that any of your really important doctors, the people that are most important to your health care, are covered by your new plan. But you still need to make sure that they know that there's been a change to your insurance and your carrier. After that, you want to start thinking about prescriptions. When are those prescriptions due? Let's make sure that all of our information is on file. If you have to go through maybe a prior authorization process for your prescriptions, it's important to get ahead of that so that by the time those are ready for pickup, you don't have any surprises.
Perfect, perfect. Here's an important one. So let me answer this one real quickly since it's in the news and a lot of people are really freaking out there. Stacy asked, I heard that Trump is putting a freeze on Social Security. Is this true? No, it is not true. There was a couple of page document went out there that is going to freeze federal funds to a lot of organizations, states. But Social Security, Medicare is not one of those. Even Medicaid, but there's a little gray area there. But no, Social Security is still good for now. There's a lot of federal employees are kind of freaking out like right now. They're return to work, which is fine, but that's going to reduce customer service. I guarantee it. I've done a few videos on that and explain why that happens. All right, Patricia asked, if I switch supplement companies, does my annual physical date remain the same to get a no deductible physical? Either one of
Well,
y'all?
you're sure, yeah, you're entitled to that Medicare's that $0 medical physical once a year. So your date should not change, but it's not going to reset. You get that one time per calendar year. It's got nothing to do if you switch your supplement and save money, which by all means call us. We can help you. You get that one time $0 medical physical.
But it's yeah, they call it a physical, but Medicare physicals are
They're limited. It's not
yes.
a full physical.
Yeah, yeah, it's not a full physical and stuff, but, yeah, it's kind of a, "Hey, doctor, how's everything going?" and kind of thing, right? But, yeah, they should really
Yeah.
expand those, but, yeah, but it also depends whether you have a Medicare Advantage plan and maybe they have some extra services there as well, right?
Right. Yeah, I mean, you're exactly right. They're just gonna kinda poke and prod you a few times and send you on your way. They don't do a lot of the important testing. With those Advantage plans, you're entitled to all kinds of tests that are preventative that are $0. Just look into your summary benefits and find out what kind of tests you can get. But with the supplement plan, as long as that doctor accepts original Medicare, make your appointment. You may have to meet your deductible, which is small, it's $257, but you can, kinda get what you need done. Take
Right.
care of yourself, get ahead of things before something pops up that you don't want surprises.
Exactly, exactly. All right. So prior authorizations, we hear a lot about this in the news, and unfortunately for it, yeah. But anyway, how to navigate prior authorizations. So, Do you have prior authorizations with a Medicare supplement plan, a plan N, G, or F? No, right? No,
No,
no prior authorizations with Medicare supplements, right?
correct.
So we're only talking about Medicare Advantage. So, Alyssa, you want to talk about prior authorizations and what you all do to help people navigate that?
Yeah, absolutely. Prior authorizations in the Medicare Advantage space can be a little bit frustrating because it takes a lot of coordination between your carrier and the doctor's office. And as you would imagine, there's people actually, pushing paperwork and buttons, and oftentimes maybe don't exactly know what they should be doing or what they should, or how to get the process done most efficiently. I think that's actually one of the things that makes the member success team the most valuable here at Chapter is we've dealt with hundreds, if not thousands, of prior authorizations from these carriers over the years, and we've truly understood the best way to get them done efficiently and get people an answer as quickly as possible. Oftentimes, that means us stepping in, calling doctors' offices, calling carriers on behalf of our members to make sure they get done quickly and properly the first time.
Perfect, perfect. On another question here from Charles on Part C, do you still have the Part A and Part B deductibles and still have to pay Part A and Part B premiums? So, Felix, number one, what is Medicare Part C?
So Part C would be your traditional Medicare Advantage plan that replaces your right to original Medicare. It's a two-part question. So those deductibles are sort of built in, and we'll talk about what a maximum out of pocket is here in a moment. But you should be entitled to premium free Part A, but if you've worked the right amount of quarters. Part B premium is still going to be deducted from your Social Security check if you set it up that way. So yes, you are still obligated to pay that. Most of these plans are going to have what we call a MOOP, or a maximum out of pocket. Those can range from anywhere between $2,000 all the way up to $10,000 depending on your plan. That's one of the first things that we look at, especially if you're going to go to the doctor a lot or have a lot going on. We want to keep that number low. Once you reach that number, essentially everything after that, if you're going to doctors that accept that plan, you don't have anything else out of pocket. So we're going to try to keep that number as low as possible.
Okay, perfect, perfect. All right, let's see. Concerned Sunshine says, concerned about your recommended supplement Medicare G instead of Advantage Medicare. What's the dollar comparison? How much will be taking from my monthly check in both examples? Well, yeah, if you have a Medicare Plan G, those do have a premium. You have to pay for those, the no prior authorizations and the no networks. Unfortunately, there is a cost for that, and it really depends on your particular state. But most Medicare Advantage plans have zero premium. So on either of those, you still have to pay your Medicare Part B, the $185. But on a Plan G, you have to pay for the monthly premium for Plan G or a Plan N or a Plan F. And then you also have to get a prescription drug plan, a standalone prescription drug plan. The prices of prescription drug plans this year, Felix, are going up, going down. What are you seeing happening this year?
And it varies across the board. I've seen some that are zero, some that are 50 cents, some that are $100. It really depends on which medicines you're taking. We're obviously going to try to keep that premium low if you're not taking anything, but you need to have one in order to prevent any type of late enrollment penalty. But sometimes it makes sense to pay a little bit more in premium if it eliminates the deductible or it keeps your copays low. But that's our job to look at that stuff and find out which one makes the most sense for you. So we're going to collect your drugs, your dosages, do a search in our system and determine which carrier and which plan makes the most sense for you. But it varies widely across the board. I've seen, like I said, 50 cents all the way up to $92.
Yeah. It's crazy when you look at drugs, you're trying to find prices on drugs and you find one that has like a capsule versus a pill, and I guess it's the same ingredients and everything, but one is a liquid and the other one's a hard pill, and there's some of those things that are like 3 or 4 or 5 times more expensive, aren't they?
It can be, yeah. The tiering can be all over the place. That varies as well. And again, we're going to ask you which pill or capsule you take and get that put into place to make sure that we make the right recommendation.
Perfect, perfect. All right. Let's see here. Alyssa, over-the-counter fitness, dental, vision, hearing benefit, how to take advantage of all that once you're actually signed up.
Yeah. Another really important thing to do at the beginning of the year so that you can take advantage of those benefits throughout the entirety of 2025. One thing that we see will often happen is people have their Medicare Advantage plan, are excited about a certain benefit, but, it's not always clear how to actually utilize that benefit. Who do you go to? They'll use, third-party carriers or other things to actually, give that benefit to their members. It's not always easy to understand how that works. The best thing to do is if you're a chapter member, obviously come to the member success team because we'll tell you anything and everything about how to utilize that benefit and make sure that you have everything you need, whether it's an OTC card or online access to take advantage. Now, if you don't have that, you can reach out to your carrier and they should be able to provide you some information. There will also be some information in your summary benefits and other things. Just keep in mind, you want to make sure that you set those benefits up early so that you can take advantage of them throughout the year.
Perfect. Yeah, the CMS, Center for Medicare and Medicaid Services, they still mandating those mid-year, hey, you've got these benefits available letters that are supposed to be going out in June or July?
I believe they are, but Felix, fact check me in case I'm misremembering. Last time I heard.
Yeah, last time I heard they were as well, so you can expect
Yeah.
those.
All right, but we'll have a new commissioner of CMS coming, and
Yeah.
so things might change. So basically, what it was is, I think that was part of the Inflation Reduction Act on the previous president. He said that one of the problems with people on Medicare Advantage is they've got all these benefits, but they don't use them. And then says, these companies are being reimbursed, kind of, or being paid for these kind of extra benefits, and it comes out of the money you paid in FICA for all those decades. So it's your money. So go get your money. The over the counter fitness, dental. It's these companies aren't giving you anything for free. It's basically when you enroll in their particular company, whichever one is best for you, then those guys, in their $10,000 suits go to Washington D.C. with cup in hand and say, "Hey, we just signed up Wanda. Give us the money that she paid into FICA all those decades." And so that's where the money comes from. So it's basically you just getting your money back. So, but the problem is a lot of people, they have, $1,000, $2,000, $3,000 of a dental. They haven't used it. They haven't used their gym membership, their transportation, their over-the-counter grocery card, whatever the case may be. And either the companies are making it difficult or they're not letting people know they're available. So that's where the whole thing about in July, as of right now, I haven't seen anything change yet, but as of right now, you're supposed to be getting a letter in July that says, "Hey, you've got dental benefits available. You got gym membership." Everybody forgets going to the gym after what you usually the New Year's resolution lasts from January 1st to about January 7th or something. So stay away from the gym for the first couple of weeks, but then you can go back, right? But yeah, so hopefully the letters still go out. But with Chapter, y'all don't need the letters. Reach out to Chapter if you're one of their members, and they will say, "Hey, oh yeah, you've still got dental, you've still got this, you've got a gym membership," and they will help you navigate that process and get what you paid for, get your money back, right? All right, speaking of those grocery carts, either one of y'all, because this is a big thing. I get this question all the time. Do they exist, or is it just social media, internet clickbait, internet myths?
I'll take it. They exist. I think that some of the advertisements that are out there are a little bit exaggerated or maybe misleading, and that's typically how the internet goes.
Way exaggerated.
Right. Well, it's yeah. I'm being kind. More often than not, you're going to find grocery benefits and add-ons into plans that are for folks that have Medicare and Medicaid. We call those dual special needs plans. They are not included in all plans. Very, very rare to find that. But for people that have Medicare and Medicaid, a lot of times you can make a choice, or you can have that additional spending to get healthy foods like meats, vegetables, certain things like that, dairy. But they exist. But a lot of what you're seeing out there online is, like we said, greatly exaggerated.
Yeah, yeah. I always say it's like you call here and you can get $500 a month and free ice cream for life and unicorns and yeah, so they just come on people and it's kind of a click kind of switch type of situation where you call them and they take the best grocery card in the country and one particular zip code in West Virginia that has incredible benefits and then they advertise it to the entire country and everybody in the entire country calls and they say, "Oh, if you don't live in West Virginia, oh, well, sorry." But then they do the whole hard sell and try to sell you on something else, right?
Yeah, you see that across the board, and it's frustrating because we know that's happening to people. But if you feel like you're entitled to more, you want to see that, give us a call.